You're in Texas, you sold your house, you're looking for a new job. So you can't tell me you believe that you're going to get your job back.
I am very hopeful I get my job back. And if he offers me my job today, I will still live in Texas and I will work for Eastside Fire and Rescue.
We've been talking about the issue of vaccine mandates and specifically the impact that they're having on public safety. We know that there are police officers, there are firefighters and first responders who were fired for refusing to get the COVID vaccine. If you've been following unDivided, we've specifically been focusing on Eastside Fire and Rescue, which is a fire agency in a suburb of Seattle that terminated firefighters for refusal to get the vaccine, did not accommodate their religious exemptions. And now the group of fired firefighters have filed claims totaling $170 million. So they're looking for $170 million in damages from their former agency. The claim is a precursor to a lawsuit. I spoke with one of the firefighters who is part of that effort. Introduce yourself, sir.
I'm Rocky Martinez.
And what is your former job title with Eastside Fire and Rescue?
I was a lieutenant and the hazmat team leader for Eastside Fire and Rescue.
Tell me a little bit about your career as a firefighter.
I spent 18 years with Eastside, 3 years as a volunteer prior to being hired. I was hired in July of 2003, right after returning from Iraq, my first deployment with the U.S. Marine Corps. And then I deployed again in 2005 for my second deployment and pretty much been at Eastside ever since.
So you've been in some capacity serving your community and your country since you were an adult.
Correct. I knew when I was a sophomore in high school that I was going to devote my life to public service.
Why Eastside Fire and Rescue? For people, I know there are people who don't live in the Seattle area who watch this. Eastside Fire and Rescue essentially serves a suburb of Seattle.
Correct. It's about 220 square miles east of King County, or in East King County, serving the cities of Issaquah, Sammamish, North Bend, and then Fire District 10 and 38, which are kind of the unincorporated areas around those cities. Eastside, why I wanted Eastside was because I actually grew up in Sammamish before it became a city. I graduated from Issaquah High School, went to Pine Lake Middle, even Sunny Hills Elementary for fifth grade. And so I wanted to give back to the same community that gave to me while I was growing up. So that's why Eastside was my dream agency. And when I got hired, it was like, perfect. This is the perfect scenario. So.
Yeah, and you were able to give back to that community for a long time. It's a difficult question, but what are some of the most memorable, probably in a bad way, I imagine, maybe in a good way, memorable calls that you went on in that community?
There's quite a few. I mean, some too many to count. I think, one of the ones that kind of showed the how small the community and how tight knit the community, even though the patients involved were not members of the community. Unfortunately, it led to a fatality. It was a car accident on I-90, and seeing how small that, that 7 degrees of separation, the patient was related to my mother in a small way. My mother actually knew their landlord. So it was kind of weird, but also good that because the remaining family members were taken care of very quickly due to the incident. And, unfortunately, like I said, it wasn't a fatality, but it was nice to be able to kind of vent with the stress of that call and making sure, seeing the end result, that family was still taken care of.
You mentioned that you were hazmat team lead. Is that a really specialized position?
It is. It takes additional training. You have to be a hazardous materials technician in order to be the team leader. Also, you have to go through, further advanced training. So like incident command systems, hazmat incident command specific to hazardous materials calls. Usually it's a senior team member who has gone through more extensive training than just a technician. I actually was kind of the assistant zone coordinator. So zone 1 pretty much covers East King County, kind of like Mercer Island East. So our hazmat team is involved in the zone 1 consortium, which covers Bellevue, Redmond, Kirkland, kind of that whole East King County. So I assisted with the zone team as well. where, we got together as a zone to train and make sure our team was up to date with all their training and current technologies.
What's a hazardous material like best case scenario and worst case scenario?
Worst case scenario, it's a really bad day for a large, significant amount of population. Best case scenario is it's a small incident that the immediate crew can handle with maybe one technician or a operations personnel, which is just the level below a technician. And it doesn't have any impact on the environment or the society.
Gotcha. And forgive all these kind of questions. I'm just trying to get people to get to know you a little bit. Without, let's pretend the pandemic never happened and we would have all, continued on our lives as normal. What was your plan, I guess, for your future? And how old are you, Rocky?
I'm 42.
42. Okay. So you had some time left to work before you could retire. What were your career plans?
Was to stay with Eastside Fire and retire, stay there as long as I could, hopefully promote throughout the ranks and eventually be a battalion chief. That was the plan. It's continue serving the community till, it was time for me to call it quits.
So tell me how that plan was derailed.
Well, in August of 2021, the governor issued a mandate for all healthcare workers in Washington State to be vaccinated against COVID-19. Approximately September 20th, our Fire Chief Jeff Clark, made a statement throughout Eastside Fire and Rescue that there will be no accommodations for those involved in patient healthcare. So those individuals who submitted for a religious exemption or a medical exemption were not going to be accommodated based off his statement. I believe everyone who submitted for a religious exemption was approved. So their exemption was approved. But prior to even Chief Clark meeting with those individuals who had the approved exemptions, he unilaterally stated that there would be no accommodations involved in patient healthcare.
And that kind of stems from a Governor Inslee mandate, which is if you're working with patients. And so I think there are some ways Eastside Fire and Rescue's hands were tied and some ways that their hands were certainly not tied that they blamed on the governor, for a little coverage. But just, at the base level, why did you not want the vaccine?
For religious reasons. I have been through very numerous things where my faith has really been challenged. Also my deployment to Iraq, my faith has gotten stronger as I've aged. It was the calling from God that this was not right for me. I do also have a medical condition that I was not comfortable getting it, and I don't want to discuss my medical condition publicly, obviously. But so it was submitting that religious exemption and like, okay, hey, maybe there's an opportunity. Again, I would be more than willing to do any accommodation that we can come to agreement with, but there was no attempt at an accommodation at all.
I've got to play devil's advocate. As you said, you're a Marine. I have a lot of friends in the military who had all number of vaccines stuck in their arm and basically had no choice. So I guess why now would getting a vaccine or having the government mandate a vaccine bother you when you went through it in the military?
Because I was mandated before, as in my experience with the anthrax vaccine, that was mandatory when I was in. And partway through, I didn't have a choice. Yes, I was technically government property. When I signed that dotted line, I belong to the federal government, and I don't have a choice. Now I can look at what my health decisions are and make those decisions what's best for me. And unfortunately, the vaccines were not best for me.
And does that apply to any vaccine or just the COVID vaccine?
I will admit I have not taken a flu vaccine in probably about 10 years now. Those vaccines I don't feel are right for me.
Now, and I've been very clear about my opinion about the vaccine mandate. I'm not in support of it. I did get the vaccine, haven't gotten any boosters, but would it have changed your opinion of things, your approach to things, if the vaccine had been more successful in preventing transmission?
Well, I want to make sure that none of us, the 10 of us involved, are not anti-vaccine in any way, shape, or form. We are anti-mandate. Your situation is different from mine, and it's different from theirs. And every single one of us should be able to make that decision, what's best for our situation. We worked the entirety of the pandemic prior to the vaccines coming, and some of us received COVID during that. I personally did not. I actually worked the entirety of the pandemic on an aid unit. In fact, even worked on the agency's sole COVID positive transport vehicle, helped set it up, and I still didn't get COVID-19 because the PPE works when worn properly. It wasn't until I was put on unpaid leave that I actually contracted COVID. And I actually took 2 different antibody tests to confirm, was I one of those asymptomatic individuals that contracted it and had no idea. And both antibody tests said negative, that I did not have any antibodies against it. So the PPE worked.
Just to be clear, is your objection more philosophical, or is there a specific religious reason why you don't want to get the vaccine?
Like I've stated prior, in any significant situation that's going to be life altering, I've always looked to God, prayed to God, and God responded back with a gut feeling: do not get this. And why can I violate that? There's multiple times where I've gone back. It's like, hey, hearing from friends and family, the easiest thing to do is just get the vaccine. Absolutely. But I can't violate that now. God is continually telling me, do not get it.
Rocky, when was your separation date with Eastside Fire and Rescue?
My official, so I was placed on unpaid leave on December 13th of 2021. And then I was separated from the agency officially, or terminated, non-disciplinary separation, on April 18th of 2022.
From when the vaccine mandate came down in October to April, was there any point where you were hopeful that you'd be able to keep your job?
Yes. We on April 4th, we had to notify the agency if we had an intent to get vaccinated and return. It was kind of a 2-week notice that yes, we were going to come back, or no, we weren't. We requested from the agency if we could have a review of our accommodations based off the information that changed over that time period, the data that had come out, and there was no response from the agency.
Who, at the end of the day, are you angry with? That's a weird question, but is it the governor? Is it your agency? Who do you blame, I guess, for you not being a firefighter at the agency you wanted to retire with?
I will change the term from angry to frustrated. Okay. The mandate allows for exemptions and accommodations. And as we've seen over the past couple months, even the governor clearly stated that, it's the employer who has that legal right to approve or deny an exemption and approve or deny an accommodation. Part of that in the mandate is also the law, the Title VII law, that they have to prove undue hardship. And there has been no discussion of that. It's just, we can't do it because Dr. Ray made a recommendation. Dr. Ray even responded that ultimately staffing decisions are made by the individual fire agencies. So, it's the frustration is the finger pointing. Ultimately it lies with Fire Chief Jeff Clark. He is the one that makes that determination of, is he going to keep this staff through an accommodation process, or is he not? And he has made the decision he will not.
And I don't want to assume that everyone listening has followed our coverage of this. So who is Dr. Ray?
Dr. Ray is a King County medical program director. So he actually oversees all the EMTs and the paramedics that are within King County.
And for people who aren't familiar, we've covered this before. He actually did a study, I believe it was in coordination with the University of Washington, that found that first responders like yourself during the pandemic had an incredibly high success rate of not transmitting the virus using your PPE. So in that sense, he has kind of a history of contradicting himself in this regard. Where are you right now, Rocky?
I'm in Fort Worth, Texas.
Why are you in Fort Worth, Texas?
Well, it's very difficult to become a firefighter in other agencies within Washington State. And, so because of that, I had to seek employment elsewhere. And, for what me and my family have endured over these last now what, 9 months, 8 months, it was time for us to go somewhere else.
Now, have you officially moved?
We have officially moved. Currently, we're staying in an Airbnb in Fort Worth area. We are waiting for our house to close. Well, technically sell. It just was listed on Wednesday, and then we will be placing an offer on a home here in Fort Worth area.
Sounds a little silly. I think most people who are listening to this will know the answer, but why Texas?
Well, I need to go to a place where I feel I am me. And I felt that with what has happened in the community that I lived in, that's not me anymore. It's not safe for me and my family. And it was time to go.
So this brings me to kind of the latest development in all of this, because while you've moved, you have not let go of the issue pertaining to your termination. So you and a handful of other former Eastside firefighters have filed, I believe it's official, a series of claims totaling $170 million. What are you alleging in asking for that money?
So those are tort claim damages. It's an administrative procedure that needs to be done prior to litigation being filed. The total of the 171 million actually is all 10 of us, not one individual. And it is discrimination based off of age, sex, and religion. And so those damages were assessed for future earnings, income, benefits, some mental anguish, defamation of character, those types of things. So both non-economic and economic damages.
Let me break some of that down. Age, sex, and religion. Are you saying you were discriminated based on your age and your sex, or just religion?
All three. So Fire Chief Jeff Clark said that he would save $1.08 million by separating 15 was the assumption number that when he presented it to the board in September, and that he would save $1.08 million separating the 15 experienced firefighters and bringing in 15 new firefighters. He would save that money. Unfortunately, he's not saving that money when he's averaging about $460,000 a month in overtime just due to the staffing cuts.
What does your gender have to do with it?
So he did accommodate some individuals, a total of 3, 2 females and 1 male, that were accommodated into a light duty status from October to approximately, one of them was April. Another one got vaccinated around December, I believe.
Is the thought there that they just wanted to keep diversity in their ranks?
I can't make an assumption, but based off the information, I would say that was probably the reasoning behind it.
Well, because I don't want to assume, but you don't look white to me.
I am Hispanic.
Okay, you're diversity. You count for diversity then.
I am also a disabled veteran.
Okay, so if the idea was to keep diversity, then they could have given you some sort of light duty status, right?
Correct.
What is the goal here, I guess, with the tort claim? As you said, tort claims are a precursor to a lawsuit. What do you hope that this $170 million ask does?
Well, as we've explained to the board of directors over the last several months, that all the meetings we've attended, is none of us want to seek litigation. None of us want tort damages. It's not about the money. We all want to return to work, and we can do it safely. As we've seen in the past, and as you mentioned, even with Dr. Ray's study, we can work safely. The accommodations that a majority of us asked was testing every day that we work, which we were doing prior to the vaccines coming out, wearing the N95 mask, wearing the PPE, the goggles, gown, gloves, all that, anytime we were involved in patient healthcare. And there was no attempt at even trying to continue that path. And so it's like, we can work safely. Let us. And no, they're not allowing us. There's not even a conversation about it. And that's what we're trying to ask the board is, hey, have this conversation with the fire chief and see if there's a way. Other counties and Washington State have brought back their unvaccinated firefighters, and they are working in patient-facing positions. Why cannot King County? Why so unique about King County?
You tell me that your goal is to get your job back, not necessarily the money, but something tells me you don't believe that that's going to happen because you're in Texas. You sold your house. You're looking for a new job. So you can't tell me you believe that you're going to get your job back.
I am very hopeful I get my job back. And if he offers me my job today, I will still live in Texas and I will work for Eastside Fire and Rescue.
How will you do that?
A lot of commuting, a lot of flying. We actually do have other members that do live in other states.
So you will, if they were to say, okay, we'll give you your job back, you're going to keep a residence in Texas, but you'll come back to work.
Absolutely. I want to work for Eastside Fire and Rescue.
How's your family doing through all this? Just the loss of a job, the stress of kind of not knowing for 7 months, picking up and moving across the country?
It's been very challenging, very stressful, a lot of tears, a lot of unknowns, a lot of fears. And, again, our faith is what's pushing us through. Right now, I will admit, no job, no home. We're truly taking a leap of faith, but I know ultimately that we're going to be very successful. And, again, this isn't where I want to work. But if it's the only place I can work, then I have to be here.
Rocky, let's end with this.
Okay, yeah, go ahead.
Sorry. To have served your country in the Marines, to have gone on to serve your community as a firefighter, something, both of those things that the majority of the population would never sign up to do, and to lose your job in this way, how are you doing?
It's a hard question to answer. It has been very stressful. A lot more gray hairs, balding a lot more. But again, it's the challenge is being taking that one step forward. I have to continue. I know ultimately that I will be rewarded because God has told me that in whatever fashion that may be. I'm really hoping it's returning to work. Because that's all I really want. I want to continue serving the community of Eastside Fire and Rescue, and hopefully that will happen. But if not, we'll have to pursue the other avenues. And I really don't, and I can speak for the other 10, we don't want to pursue litigation, not at all.
If you like this video, make sure to become an undivided subscriber to help us grow this mission to give common sense a comeback. You can do that in 2 ways, at patreon.com/undivided, or by becoming a contributor on my locals community, brandikruse.locals.com. Thank you to the founding sponsor of Undivided, 1530 Mortgage. Visit them at 1530mortgage.com.